talked about the drug war that started under Ronald Reagan. Just say no and those sorts of things. Has your task force or any of the other agencies looked at the possibility of decriminalizing a lot of those drugs since for 40 years it hadn't seemed to work?
I have.
Does the joint task force or anything have those discussions?
No.
Y'all just go by what the law is now?
We just have to enforce the law.
Just enforce the law. Okay. Yes, Phil?
Is there any, on a state level, any kind of, does anyone know of a database or any kind of thing like that where doctors who are over-prescribing and pharmacists who are just anybody walking in with a script, is there any kind of a database where you're limited to the amount, oversight, to where you're limited to the amount you can get of a certain drug if you're overdoing it and going beyond what your doctor's originally intended? Is there anything like that existing on a state level?
Yeah, there is. So it's called the Prescription Drug Monitoring Program, the PDMP. It's
Only on cold
it's been for the healthcare workers in the room. You probably know it's been optional for doctors to use it in the past. They just passed a law this year to improve the database because I guess it was not super usable, and so they're going to improve the technology, and then I believe it's in the middle of 2018 that doctors are going to be required to use it anytime they prescribe an opioid or I believe any kind of benzodiazepine medication. Again, healthcare providers would know more about that. I'm not a nurse or doctor.
From your electronic, our electronic health information system, there are risk codes. They could be that you had a bacteria that's hard to treat with antibiotics, or that you've been violent in the emergency room in the past, or other things, one of which is that you've had drug-seeking behaviors.
Because one of the problems I know is a person can go to one doctor and get a prescription and then drive 30 miles away to another doctor, get the same prescription for the same problem, go 30 miles away and get another one. I don't know of any of those Dr. Mills and things that you saw on TV in Florida in the Northeast Georgia area. I haven't seen any of that going on. But this will help if they can track Richard. If Richard goes to Dr. A and gets the prescription, when he goes to Dr. B, they see he's already gotten a prescription, and so they, I guess, would be prevented from giving him a second or a third or a fourth, which is a good idea.
And the new system at Northeast Georgia Medical Center that's been kind of a pain that I've gathered, just a small pain, getting implemented is going to do wonders for that from what I've been told. My grandmother personally is in a nursing home, and they actually flagged her for, and I said, she lives there. Why did I not know that? And, it was something crazy, like, well, she's taking a Tylenol and an aspirin, but she's also on a lot of pain medication because she needs it.
Right.
But they flagged her, and we got a phone call from the nurse. I said, but she lives there. You give her that. So there's some of that stuff that I think the new system is intending to help if it gets up and running the way it's intended to in Northeast Georgia.
I'm sure there'll be some hiccups before it gets finished. Yes.
Well,
We also take several reports a year of medicine being stolen out of people's houses. Especially the user pushers. They'll get stocked up and then their medicine will get stolen and they need a report so they can go back to the doctor and get another prescription. I mean, that's life, folks.
That's true.
So sometimes it could also be where I know my grandmother gets something for pain because she's got cancer, and a friend of mine just goes in and steals that drug.
That's why I encourage everybody sitting in this room. If you got grandkids and you got medicine that you got 6 months ago sitting in the medicine cabinet you don't need, bring it to the office and put it in that box in front of my office there. Your kids, grandkids are getting this medication and putting it in a bowl and having a Skittles party.
Does every sheriff's office have that? Have like a prescription drop?
Most of them do,
Okay.
yes.
locks are only made for honest people, folks. Now, so at one point, we've got to quit enabling and teach responsibility.
Amen.
Because I know, and I'm not as old as some of you, but I'm a lot older than some of the rest of you in here. but we had things called parents. And I knew if Mama says, you mess with that stuff, I knew she would kill me because she said it, she meant it. And I am a retired educator from Gainesville. So that alone, I'll tell you, I've seen a lot. And, you know, we've got to quit enabling these problems and stand up and be an adult and say, enough is enough. You know, hey, I agree with Josh. I never smoked a joint. I tried, couldn't in hell, I choked myself when I stole my sister's cigarette.
There's a GBI's agent sitting right over there.
I don't think past history can get you arrested, it has to be possession, right?
The thing about
Unless you don't have it
is,
down.
you know, we are doing everything other than teaching in our school systems. We have some special ed children in our school systems that sees, not just once a day, but 5 times within an hour. We are now not just teachers, we're nurses, and we're everything else. I was afraid to give my own diabetic shots, and here I am trying to save this child that's seizing in my classroom. Okay? And, you know, if a little pot will help this child, hey, I'll grow it and go give it to him.
And most of that medical marijuana, though, is not smoking joints.
I understand that.
It's a specially
I
concocted
understand that.
cannabis that is in a pill function or capsules, that sort of thing. And
I
it doesn't get them
understand that.
high, it just handles the nausea and the pain threshold kinds of things.
But I
Georgia
also,
has not passed any law that would allow you to have the 3 plants at your
I
house.
also had a sister who died of cancer. And I saw where she could not get the medication because once she took it, it changed her totally. She could be coherent one moment. She took that mess and no longer my sister. Well, when she was down and out for the count, what did her children and grandchildren do? Came and stole the rest of it. The only way she could find any ease at all. God, God gave it. That's why they can't do anything with it, is because it is a God-given plant. There's no money changing hands. That's why they won't ever legalize it.
Yes, in the back.
Isn't it actually chemically different than the medical marijuana?
Yes,
It's
it's a
grown and
different,
used wherever
it's still
prescribed.
cannabis, it's a derivation of cannabis, so in that way it's the same, but they take out it's not tetracannabinol, THC like what gets you high, it's
Right.
another form of that, but it is from the cannabis plant, but it doesn't get you high, it just takes care of those nausea, and it's a pain reliever, but they don't prescribe you joints that you could. Now in California, they do prescribe joints, and you can go and smoke it and whatever for various things. But the medical marijuana in Georgia is very limited. It's only, I think there's 2 different kinds that are acceptable, but both of them don't get you high. They just deal with the nausea and the pain.
I do, Brian, I don't mean to interrupt you, but I do want to say a quick thing. You know, as a politician, we're supposed to be thinking about justice in this country. They do not patrol the dorm rooms at Yale, you know, and it's not the police's fault, but just common knowledge, they do not patrol the dorm rooms up at Yale the way they patrol the dorm rooms in inner New York, or the apartments in inner New York. All of our past presidents before Trump, Clinton, Obama, and Bush all joked about doing drugs on a recreational basis. None of them went to jail for it. Were able to joke about it later on when they got older because they all grew up in a privileged background. I don't think that a George Bush or a Barack Obama should be able to get away with experimenting with something that a teenage boy in the Bronx goes to jail for maybe a year or 2 for. That's not justice. I mean, one thing we need to look at is decriminalizing it for personal use, so that we won't be clogging up our prison systems. I don't know that it's worth putting somebody in a cage, you know, over a joint. Now, violent people, the ones who sell heroin, they need to be in a cage. But a teenage boy or a girl with a joint in their pocket, I don't think they're a danger to society. But that's my political opinion. I know it's a little.
Correct me if I'm wrong, but with the advent of drug courts and those things, those people aren't getting certain jail sentences as they did maybe 15 years ago.
You're right.
And then they would turn that person to try to get their dealer, and turn that dealer to try to get a distributor. Now with drug courts and things, that's extremely rare that would happen. But you're right, there's always been, I mean, nowadays the opioid is a crisis, and it's a national public health crisis named by the president. But 25 years ago, when it was crack cocaine, it was lock them up forever because they're not being responsible for themselves. Now that it's in a different demographic group, all of a sudden we want to solve the problem by treatment. And I'm not saying we shouldn't do that. I'm just saying that it's a natural thing for people to look at it through their own tribal lens. When you're doing it, it's bad. When I'm doing it, it's something that I couldn't help. That's just a normal situation.
I just said it's really the synthetic stuff is what's killing.
Right.
Talking about earlier.
And there's not a way to keep that from getting people. If you're going to use it to end pain, which they should be, then you're going to have some people abuse. Thank you for your attention this evening.